after alarm bells sounded warning of a deadly virus from Wuhan, China, there is a new coronavirus variant that was first identified weeks ago by scientists in Botswana and South Africa, according to the New York Times, that is threatening to extend the pandemic. On this next edition of Our Voices, we will look at the impact of the new Omicron variant and the reintroduction of travel restrictions and testing requirements. The Omicron variant, as named by the World Health Organization, is quickly spreading worldwide. Now, governments around the globe are reintroducing travel restrictions and testing requirements as public health officials continue to collect data on its effects and impact. At least 200,000 COVID-19 vaccines have expired in Senegal without being used in the past 2 months, and another 200,000 are set to expire at the end of December because demand is too slow, says the head of Senegal's immunization program, according to a Reuters report on December 13th. The main problem is vaccine hesitation, says Ousseynou Bediani, who is in charge of Senegal's vaccine rollout. Meanwhile, many African nations are still struggling to receive doses of the vaccine to end the spread of the virus. We will discuss this and more on this week's edition of Our Voices. Hello, I am Sumenyi Shekoye and this is Our Voices. US President Joe Biden says the highly transmissible COVID-19 variant Omicron is a cause for concern, not panic, and defended his much criticized decision to restrict travel from the Southern Africa region where it was first reported. VOA's Anita Powell has more from the White House.
The enemy has a new name, and it is Omicron. The highly transmissible new coronavirus variant was first identified by South African scientists and named for the 15th letter of the Greek alphabet. President Joe Biden.
This variant is a cause for concern, not a cause for panic. We have the best vaccine in the world, the best medicines, the best scientists, and we're learning more every single day. And we'll fight this variant with scientific and knowledgeable actions and speed, not chaos and confusion.
Shortly after the new variant was announced, Biden imposed travel restrictions on several southern African nations. That drew the immediate ire of South African President Cyril Ramaphosa.
These restrictions are completely unjustified and unfairly discriminate against our country and our Southern African sister countries. The prohibition of travel is not informed by science, nor will it be effective in preventing the spread of this variant.
But Biden argues that he's using the restrictions to buy time for more Americans to get vaccinated and take other preventive measures.
The very day the World Health Organization identified the new variant, I took immediate steps to restrict travel from countries in Southern Africa. But while we have that travel restrictions can slow the speed of Omicron, it cannot prevent it. But here's what it does. It gives us time. It gives us time to take more actions.
Dr. Tyson Bell, an assistant professor of medicine at the University of Virginia, said there's a lot that scientists don't know about this new variant. For one, whether it's more dangerous. Without knowing that, he said, it's hard to know what the best course of action is.
Both sides of this argument have good points. I think that if you look at where the virus has been isolated now, the Omicron variant, it's in many more countries now, several countries in Europe, and that includes people who do not have direct ties to Southern Africa or South Africa. And so I think the point that this seems discriminatory, it does. The countries that are on the restricted list do not overlap with all the countries that now have isolated cases. And so on the other end, I think that the Biden administration, Dr. Fauci and others, they're trying to contain the spread and buy more time.
President Biden urged unvaccinated Americans to get vaccinated, and for the vaccinated to get booster shots if eligible. That's sound scientific advice, Dr. Bell said, and not just for Americans.
This really should be a wake-up call that we need to do as much as we can to get the global population vaccinated, because ultimately, if more variants are able to thrive because virus is circulating at high levels, we have to fix that through effective vaccination and getting it out.
As variants continue to pop up, doctors keep coming back to the same messages for everyone: old, young, American, and otherwise. Mask, distance, and vaccinate. Anita Powell, VOA News, the White House.
Here to discuss the discovery of the Omicron is Dr. Angelicottes, who serves as the chairperson of South African Medical Association and was the first to identify the new variant, which is responsible for the recent spike of infections in the country. She explains what to look out for, and she says the Omicron variant may not be clinically detrimental in comparison to the Delta variant.
I think what is extremely important is to understand when we say it's mild disease, it doesn't mean that you're not going to feel ill or sick. You will, and especially if you're unvaccinated, because the three major dominant symptoms is headache, body ache and pain, or muscle pain, and the fatigueness or the tiredness. So I'm always saying, or what we have seen now the last few days, is that unvaccinated people will have a more intense headache and a sore body than your vaccinated people. The problem is we need to see in South Africa now, within the next week or two, what will be the impact on the severe disease, whether you're young, old, if you get COVID or Omicron, unvaccinated versus vaccinated.
Also, COVID is also something that leaves longer symptoms. Once the flu-like symptoms are gone, there are some complications that seem to come up later. How about this Omicron? Do we know anything so far?
So far we know, as you have correctly said, that it is predominantly mild symptoms, especially in the average population out there. We know it is a fast-spreading virus. Whether it will be, in the end of the day, more transmissible than Delta, we don't know, because you still need to look at where your numbers are going to go at the end of the day before you turn your curve. But it is quite transmissible. We know that you can detect it with a PCR test, that is that nose swab. And we know that they can distinguish between the other variants versus Omicron, because they're supposed to have 3 genes that they test for with all the other variants. But luckily, Omicron only have 2, so it's easy to see it. Once if you know what to look for, it's quite easy.
How much do you know so far about the ability of the current vaccines we have to protect against this Omicron virus? Because I saw one news report that Pfizer, for example, can only partially protect from Omicron.
We see all pictures. We see the vaccinated people getting breakthrough infections. We see people previously had COVID, got fully vaccinated, get infected again. We see people who never have been vaccinated but had COVID before and getting reinfected. Then we see people unvaccinated getting infected. So you see the whole spectrum is out there. All the combinations are there. However, what we see at primary healthcare level is mild disease. So it means that the vaccines still protect with mild disease. Whether it's 100%, that I won't say, because the patient, they come in with their body ache and pain. But the vaccinated people don't experience the headache or the muscle pain as severe as the unvaccinated people. However, in the hospitals, our hospital rate are slowly increasing, but it's mostly unvaccinated people. And here is where the vaccines are so important. We need to understand whether the Pfizer or the Johnson & Johnson that we use in South Africa, whether it will protect you and how much will it protect you against severe disease when you lie in ICU. And that we don't know yet.
As we all know, access to vaccine in Africa remains the lowest. Will that put the continent at risk of having, more new variants? And does the vaccine inequality also affect the rest of the world?
If you can get tablets or a nasal spray that's easy to distribute, easy to get it out to the mass people there, and that is affordable, I think that would be a game changer. But for now, the injectables, it's quite difficult. Even in South Africa, the logistics around it is just a nightmare. It might be much easier in the first world countries, but Africa is not a first world country. And we need to understand the logistics, the difficulties in Africa. So if we're not going to vaccinate Africa, no one can sleep safe. You can close all your borders as much as you want to.
South Africa played a big role in identifying this Omicron, and yet is subjected to travel bans. How does that make you feel? And as a scientist, and especially as someone who played a key role in identifying this, discovering this variant, what is your advice to best protect people from this variant or any other?
I think going forward that there should be a policy. I know the World Health Organization is looking at the policy if you want to announce there's a new variant, and I think it's extremely important to have some sort of measurements in place so that you have that open communication and the ethical obligation from your scientists to announce to the world that, look, there's a new variant, and that without fear of being criticized or being slammed with a travel ban, especially in this case. I think that is important. I couldn't believe when I saw what happened with the first travel ban. Remember, at that stage, it was already a week that we have seen the clinical cases. And we said, but we're not seeing what the world is seeing. And yes, we know it's early days, and the world is telling us, this is going to be, it's going to take 2 or 3 weeks before we will know, and let's close our borders. And I said, that virus is already in your own country. Because of the mildness of the symptoms, you missed it. And your technicians looking at the PCR missed it. So what are you going to close? Let's rather vaccinate people. Let's bring normal measurements in from staying away from crowds. Wear your masks. Do that type of, social and interventions and vaccination before you just slam your borders. It's not going to help.
Although South Africa was the first to identify and warn the world of the new variant, the sudden travel bans imposed on the nation is dealing a heavy blow to an already struggling economy. South Africa's President Cyril Ramaphosa says the regional travel bans are unscientific and risk forming a global health apartheid.
These bans will cause untold damage, in particular to travel and tourism, that sustain businesses and livelihoods in South Africa and the Southern African region. We have already heard reports of how these bans are reducing the effectiveness of our businesses in South Africa almost by 50%, as many travelers who would have come to South Africa and indeed to our sister countries in Southern Africa have already started cancelling their travel plans.
It's time for a short break. But first, do you think the travel ban is based on science? Do you agree with many African public health officials who say it's a typical Western response towards Africa? Are the travel restrictions allowing more time for the West to study the new variant and implement measures to contain it? Please share your thoughts on our social media platforms. We are on Facebook, Instagram, and Twitter, and our handle is @VOA Our Voices. We are also on WhatsApp, and our number is on your screen. When we return, we will take a closer look on how the US aims to boost COVID-19 vaccine production by 1 billion doses by 2022 to address lower vaccination rates in developing countries. We'll be right back.
We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the governments to listen. It really was powerful because it showed what is possible when men and women band together and say, enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
Welcome back, and you are watching Our Voices. According to drug makers BioNTech and Pfizer, their 3-shot course of COVID-19 vaccines will work against the new Omicron variant and can be delivered by March of next year. The White House announced this week that the US is aiming to raise COVID-19 vaccine production by more than 1 billion doses in 2022. The intended increase in effort and manufacturing comes as US lawmakers are questioning inequalities in global vaccine distribution and vaccination rates among richer and poorer nations. VOA congressional correspondent Catherine Gibson has more.
The U.S. effort to vaccinate the world, providing more than 235 million vaccine doses to over 100 countries to date.
We have proudly donated more doses than all other countries combined. We will continue and must continue to donate more and more doses. Currently, we're donating 1.2 billion doses to the world. This includes the U.S. government's groundbreaking deal to deliver 1 billion donated doses of Pfizer vaccine to countries in need through COVAX.
But this week's announcement follows months of pressure on the Biden administration to step up the effort. Even Democratic lawmakers are questioning why the White House has not done more to close the vaccine gap between rich and poor countries.
Even as many of us in the United States are receiving booster shots, fewer than 5% of people in low-income countries have received a single dose. By some estimates, many people in low-income nations will not have access to a vaccination until 2023 without significant increases in worldwide vaccine production and distribution.
U.S. health experts say that while vaccination rates in North America and Europe are at about 50%, those rates drop to as low as 10% in Africa.
What is the problem? What's the bottleneck? And are we getting any better with countries where there are, quite frankly, the descendants of Africa? Because once again, we see the inequities in Black and brown countries throughout the world.
Even though the U.S. has delivered 50 million vaccines to Latin America and the Caribbean, lawmakers say the Biden administration's efforts have lagged too far behind.
Russia delivered its first vaccines in February of 2021. China made its first delivery in March of 21. And President Biden's administration didn't deliver vaccines until June.
Health experts tell lawmakers the U.S. is just now catching up because of a number of factors.
It was the priority that we had to give to domestic requirements. Secondly, that we went through rigorous procedures to make sure that anything that we donated was safe and reliable.
One possible turning point for fighting COVID-19 globally, Pfizer announced it would allow generic drug manufacturers to produce its antiviral pill for lower and middle income countries.
I think we're going to have significant quantities of antiviral. Vaccines plus the antiviral. It's the first time I can sit here and I'm beginning to see a way we can get this under control. Not eliminate, not get rid of the virus entirely.
The U.S. Food and Drug Administration began consideration of emergency authorization for that pill this week. Catherine Gibson, VOA News, Washington.
It's time for another break. When we come back, we will take a look at a campaign in South Africa that's using a wink and a prayer to get the citizens vaccinated against COVID-19. Stay with us. The World Health Organization reports that South Africa is in the grips of a fourth wave of infections, witnessing nearly a 255% increase in cases of COVID-19 in the past week, despite having the continent's best vaccination rate, according to the New York Times. Under 25% of the nation's population has been fully inoculated. More companies and institutions in South Africa are making COVID-19 vaccinations mandatory as this wave of infections, driven by the Omicron variant, hits the country. To help ease vaccine hesitancy, South Africa's Religious Forum Against COVID-19 is campaigning for religious followers to take the jab. Marze de Klerk reports from Johannesburg.
Volunteers at the BAPS Sri Swaminarayan Hindu Temple in Johannesburg are urging the public to get a COVID shot at their government-registered vaccination site. They have vaccinated about 3,000 people since September, but South Africa is seeing a fresh wave of infections driven by the Omicron variant.
We wanted to create a site that was comfortable, that people could move around in and get their vaccine quickly. BAPS Charities has done a little bit of outreach work. There are already volunteers of various backgrounds and professions.
South Africa is the worst hit by the pandemic on the continent, with over 3 million confirmed cases and nearly 90,000 deaths. The Omicron variant has many here concerned that those numbers could quickly rise with a fresh wave of infections. The Religious Forum Against COVID-19 has brought various faiths together to pool resources and better address vaccine hesitancy amongst religious believers.
There is a parallel movement, so to speak, about people creating hesitancy with regard to vaccines. We do not agree with those particular situations, so let us look at solutions rather than actually being negative towards situations.
South Africa has yet to reach its goal to vaccinate 70% of adults with at least one jab by the end of the year. So far, just over 40% of adults have gotten at least one dose. Statistics indicate youth are the least likely to get vaccinated. Student Taylor Betcha came to this center because it's close to home and not crowded like others.
It wasn't bad at all. I feel that more people should do it because it's emptier and it doesn't really hurt at all.
Analysts say targeting young people should be a top priority.
If these churches and these international or this interfaith forum really wanted to be effective, it would be to find a way to target young people and encourage them to get vaccinated. And then, of course, to encourage people who have to make decisions about whether to spend 50 Rand traveling to a vaccine site to get vaccinated versus feeding their families.
While the Religious Forum Against COVID-19 does not have figures on the rate of vaccination amongst religious believers yet, giving the jab at houses of worship seems to help. The BAPS Sri Swaminarayan Temple says about 90% of its congregants are already vaccinated. Marisa de Klerk for VOA News, Johannesburg.
A new and promising COVID-19 vaccine treatment is being evaluated for emergency use in the United States. VOA's Caroline Prosity has the details.
These pills carry hope for those who catch COVID. The drug manufacturer Merck says molnupiravir prevents the coronavirus from multiplying. Taken early, clinical trials show the pill reduces the risk of hospitalization or death by half, and it's easy to use.
They could go to their pharmacy and take their medication the way they do other medicines.
If the Food and Drug Administration approves Merck's request for emergency use, the pills could be available in the U.S. before the end of the year. The company plans similar emergency use applications worldwide. But financing and distributing this drug and other treatments, including vaccines, to underdeveloped parts of the world remains a challenge.
We need to get serious about that. This is a worldwide problem that needs worldwide solutions. So I think even if you say no one is safe if everyone is not safe, I mean, it's so true.
The U.S. has pre-purchased 1.7 million courses of the drug. To help get the drug to the rest of the world faster, The Bill and Melinda Gates Foundation is putting up $120 million to push makers of generic drugs to produce Merck's drug for developing countries. Money is at the heart of any COVID treatment. Dr. Caleb Hernandez is an emergency room doctor who also researches COVID drug discoveries. He says 3 other drug treatments have been studied, including one that rivals Merck's claims for molnupiravir. He says they lack the financial backing to seek FDA approval.
Our government isn't set up to spend the $500,000 to do these studies. We rely on private companies to bring things to the FDA. And that's why you're not going to see as much innovation as you could see.
And there is concern about relying on the Merck pill instead of getting a vaccine, which experts prefer since it teaches the body to make its own antibodies.
It can prevent you from getting COVID in the first place. And we want to prevent infections, not just wait to treat them once they happen.
Dr. Hernandez sings a tribute to a colleague who quit the profession, burned out from COVID.
We've been going for almost 2 years now, fighting every day, watching people die. And I think it's difficult when people in the community don't believe you. They think that you're part of some conspiracy or you're exaggerating or making things up. And then you go to work and you have to pronounce multiple people dead.
Nearly 5 million deaths worldwide and closing in on 740,000 American deaths from COVID, with an artist paying tribute with a white flag for each. Carolyn Presutti, VOA News.
A new study released on December 14th reported that the experimental COVID-19 pill by Pfizer is highly effective at keeping patients out of the hospital, but it won't erase milder symptoms often associated with breakthrough infections. So, if you had an opportunity to take the COVID-19 pill instead of the jab, would you? Please let us know and share your comments using the hashtag VOA Our Voices. And that's where we will end our show this week. Thanks to my colleagues on Our Voices and on behalf of everyone at the Voice of America, I am Simani Shegoye. Thanks for watching and stay safe.